AM Northwest. With so many skin treatments out there, which one should you choose? Well, how about going to a doctor who actually treats your skin from the inside out? And here with more is Dr. Adam Maddox of Thrive Aesthetic and Lipo-Dissolve. So nice to have you here.
Thank you.
Talk a little bit about the break. This is a huge industry now. People, being able to use new technologies to make themselves look younger, feel better, and Lipo-Dissolve is one of them. How's that different than liposuction?
Well, it's a non-surgical procedure, so there's no cutting involved, there's no incisions. We're using a series of injections to use a chemical compound called PCDC to actually break down the fat cells. And then your body just goes through its normal elimination processes to eliminate the fat. So you're literally dissolving the fat.
So you get an injection, and then how long, or several injections?
So it's usually a series of treatments, typically about 6 treatments, spread out about 3 to 4 weeks in between treatments, and there's really no downtime. It's kind of considered the lunchtime procedure.
Now, we have some pictures here. Obviously, we have a before and after here, right?
Yeah, and this is a patient that we treated kind of the love handle area and then the upper bra area, and this was actually after 5 treatments, so this patient hadn't necessarily completed the process yet.
Is this a treatment just for the tummy area? Can you do this if you've got,
You can do it on
your back, your legs, your arms, face?
Pretty much anywhere above the knees. So inner thighs, outer thighs, the saddlebags, the chin, neck area, jowls, things like that, chest for men.
Is this painful at all?
It can be a little bit uncomfortable, but there's really no downtime. You can, after the procedure, you can go right back to work, go back to doing your normal daily activities.
Do you have to get, or do you have a physical exam before you do this to see what kind of shape people are in?
Absolutely. We do have an evaluation process that we have people to go through. Not everyone is a candidate. It's not a weight loss program. It's more of a body contouring, sculpting program where you can't just get rid of that little extra bit of fat.
Well, how is it not a weight loss if you lose all that fat? You've got to get on the scale and be lighter, right?
Well, you're really losing maybe grams to ounces of actually fat in that area, so you notice notches on your belt changing if you're treating, kind of the stomach area, so maybe you'll lose an inch or 2 of actual fat, but you won't really notice a big difference because it's not general weight loss.
Is there a follow-up that's required with this, down the road? Do you have to continue treatments to keep the fat off? Actually,
what the current research is showing is that the fat cells are gone for good, so it is a permanent process.
Because with liposuction, and I could be wrong,
sure,
I often am, but that when you remove the fat cells, they don't grow back in that place. You don't regain fat in a place where it's been removed. So this would be the same theory.
Exactly, yeah. We're born with a pre-programmed number of fat cells, so we'll never develop more fat cells as we age or anything. So once the fat cells are gone from that area, they're gone for good.
Really? Do you have something called anti-aging management? Is that that's something that people go to when they go to your office? You kind of work out a...
Yeah, so what our office offers and what we offer at our clinic is age management and aesthetic medicine. So you think of aesthetics as really treating kind of the way you look on the outside. Well, we've kind of taken it one step further and really started to look at what's going on in the inside, because the body ages from the inside outward. So looking at hormonal imbalances, diet, lifestyle changes, weight loss, we're able to get better results with our laser procedures when we're trying to stimulate collagen and address those wrinkles that are on your face. So by treating the collagen internally and externally, we get a much more dramatic result.
Well, I have to say, you had me at less invasive.
Yes.
So, that's it. We want folks to know about our Thrive is at 832 Northwest 19th Avenue. The number is on your screen, and of course, we'll link to their website from our website, KATU.com. But today, we're giving you a great deal on Thrive. Head to KATU.com and go to the AM Northwest section, and there you can click on the Great Deals icon and purchase a $50 gift certificate for only $25. These are first come, first served, so you'll want to make sure you get those quickly. And Dr. Maddox, thanks so much for coming in today.
Thank you.
Thank you.
We appreciate it.
When it comes to